Ever wondered how your body leaves clues when it's fighting something off, like an infection or even just a cut?
Yeah, it's like being a detective inside your own body.
Exactly. Today, we're doing a deep dive into the morphologic patterns of acute inflammation. Basically, the different visual ways your body responds.
And these visual patterns, they're not just interesting to look at under a microscope. They're actually critical clues.
Clues for what, exactly?
Well, for figuring out the cause, how severe it is. And that directly affects, diagnosis and how you treat it.
Okay, let's get into it then. So, fundamentally, acute inflammation means wider blood vessels, more immune cells rushing in, fluid buildup, basic stuff.
Right, that's the foundation.
Yeah.
But how it looks, the pattern, that can vary a lot.
And understanding these patterns helps us read those clues you mentioned.
Precisely. The specific injury, how bad it is, even where it is in the body, all that shapes the response. It's quite specific, really.
Okay, so what's the first pattern we might see?
Often it's something called serous inflammation.
Serous, like serum.
Yeah, think of the clear, watery fluid you get in a simple blister, maybe from a burn. That's serous exudate.
Ah, okay. So where does that fluid come from?
It's mostly plasma leaking out because the blood vessels are more permeable. Or sometimes it's secretions from cells lining body cavities, like around the lungs.
So it's generally a milder thing?
Usually, yes.
Huh.
Often indicates less severe damage.
Got it. What's next?
Then things can get a bit more dramatic with fibrinous inflammation.
Fibrinous. Sounds like fibrin, like in blood clots.
Exactly. If the vascular leaks are bigger, or if there's something triggering clotting, this protein, fibrinogen, leaks out and forms a mesh.
A mesh, like a net?
Kind of. Under the microscope, it looks like a pink, sort of tangled network. You often see this on the surface of organs, maybe the lining of the heart and the pericardium.
So it's like the body's trying to quickly patch things up, maybe wall something off.
That's a good way to think about it. But it leads to a really important question.
Which is?
Will the body manage to break down and clear away that fibrin completely? If yes, great full resolution.
And if not?
If not, it can organize. It basically turns into scar tissue. And that scarring, say, in the pericardium, can cause problems down the line, like thickening that restricts the heart. So it's a crucial fork in the road for healing.
Okay, that makes sense. Moving on, what about something maybe more familiar, like pus?
Ah, yes, purulent inflammation. And related to that, abscesses. This is your classic pus.
Usually bacteria involved here, right? Like staph.
Very often, yes. Bacteria like Staphylococcus are common culprits. Pus itself is just this thick mix. An exudate, technically.
A mix of what?
Neutrophils. Those are key white blood cells, plus dead cells, tissue debris, and fluid. Think of acute appendicitis. That's often a purulent inflammation.
Right. And an abscess is just a pocket of that stuff.
Pretty much. A localized collection of pus. Often you'll see a central area of dead tissue, loads of active neutrophils around it, and sometimes the body even tries to build a fibrous wall to contain it all.
Like walling off the infection.
Exactly. It signals a focused, intense fight, and often needs specific action like antibiotics or maybe even draining it.
Okay, one more pattern.
Let's talk about ulcers.
Ulcers. Like stomach ulcers. Or bed sores.
Those are great examples. An ulcer is basically a local defect, a hole where inflamed dead tissue has sloped off from a surface.
So the tissue is actually gone.
Right. It leaves an open sore. Common in the GI tract, like you said, or on the skin, especially if there's poor blood supply.
And inflammation-wise.
Acutely, you'll see neutrophils and dilated vessels, the usual suspects. But ulcers can easily become chronic, with different immune cells moving in and often scarring around the edges.
It's a visible sign of tissue destruction, then.
A very clear sign, yes.
So taking all these patterns, serous, fibrinous, purulent, ulcers, how do they connect back to what you actually feel or see when you have inflammation?
They're the microscopic basis for those classic signs we all learn about.
The cardinal signs.
Exactly. Rubor, the redness, and calor. The heat that's from the increased blood flow, the dilated vessels we talked about. Acumor. Tumor, the swelling that's the fluid. The edema leaking out.
It makes sense.
Dolor, the pain that comes from chemical signals like prostaglandins and cytokines released during the process.
And finally,
Funculosa, loss of function, which happens because of the swelling, the pain, the actual tissue damage.
So these patterns directly create the experience of inflammation.
They do. And looking at the bigger picture, where does acute inflammation usually lead? There are typically three main outcomes.
Okay, what are they?
1, complete resolution. Everything goes back to normal. The tissue regenerates, function is restored. That's the ideal outcome.
Nice. Outcome 2.
Healing by fibrosis.
Yeah.
Basically scarring. This happens if the damage was severe or if the tissue involved doesn't regenerate well, like heart muscle. The gap gets filled with scar tissue instead of functional tissue.
Not ideal, but sometimes necessary.
Sometimes it's the best the body can do to patch things up. And the third outcome.
Uh-oh, this sounds like the bad one.
It can be. Progression to chronic inflammation. This happens if the thing causing the inflammation just won't go away. A persistent infection maybe, or an autoimmune issue. The acute response just keeps going or shifts into a longer-term smoldering fight.
So, from a simple blisters clear fluid to the walled-off battle in an abscess, each pattern is telling a story.
A really detailed story about what the body is facing and how it's trying to cope.
It's incredible, really, the complexity.
It is.
Yes.
And understanding these patterns isn't just academic. It genuinely helps us diagnose, predict outcomes, and choose the best way to manage things for patients.
So thinking about all this, these different visual patterns happening inside us.
Yeah, it kind of makes you think, doesn't it?
Mm-hmm.
How might recognizing these, hidden visuals deepen your own appreciation for just how complex healing and disease really are inside your own body?